Hi, my name is Richard Ferguson. Today's date is August 10th, 2022, and here are my notes for the video. Okay, so for this video, I chose the skeletal system. The skeletal system was one of my uh, most favorite body systems before the midterm that we looked over. It was very interesting to me. So I chose the skeletal system, and I'll start off with the skeletal system. The healthcare providers or the primary physicians um, that are mainly deal with the bones and tendons and ligaments are orthopedists as well as orthopedic surgeons. And I'll further go into these two different specialties. So orthopedists, they're very important because they specialize in the musculoskeletal system. In addition, they help treat the areas of the bone, tendons, and ligament. They also provide rehabilitation for those affected areas. In addition, they also educate the patient and to give them ways on how they could reduce, further damage if they have any tears or injuries. That's also what they do. And then orthopedic surgeons, they're very important as well because they treat broken bones, as well as they do invasive surgery. They replace joints, and they provide treatment as well. So, for example, a orthopedic surgeon, they might do invasive surgery, so under the skin. They may do a hip replacement or a knee replacement, and this is very important for certain athletes or people that are older in age. These, they might be common surgical procedures that they could do. And then for the next part, I chose the humerus in the skeletal system. That was the organ that I chose. So the humerus is pretty important. It's a long bone, and it connects the elbow uh, to the shoulder blade. Um, in addition, it provides a base of support for the muscles of the shoulder, the upper arm, as well as the lower arm. And then for the anatomical terms for the humerus, so the humerus is lateral to the sternum because the sternum is midline, so it's lateral to the sternum. Next I have the humerus proximal proximal to the carpals of the wrist. It's proximal because it's closer to the torso. And then next the humerus is it's inferior. It's inferior to the chromium, which is superior. And then lastly, the anatomical landmarks. So the anatomical landmarks of the humerus. So first I chose the humeral head. The humeral head is at the proximal end of the humerus. Then the greater tuberosity. The greater tuberosity is on the lateral aspect of the humerus. Then next the lesser tuberosity, which is on the anterior aspect of the humerus. And then the surgical neck. The surgical neck is distal to the tubercle. It's distal to the tubercle, and it's very common in humerus fractures. And then lastly, the lateral epicondyle. The lateral epicondyle is lateral to the capitulum, and it attaches the extensor muscles of the forearm. Excuse me. Thank you for your time, and that'll be all for today.